melted. Why so
I know,
I know before Mars.
Oh, I think she's probably fine. I think she probably just needs to rest. Yeah. Yeah, no, 98's great.
I'm either going there.
Let him both rest.
I'm either going there, Texas, or
There's a little water,
Georgia.
and then you check me in and write it down what it was before, and write it down what it was after. And as long as it's less after, like if the top number, their
Yeah, I'm burning
bottom
fine.
number is still good, and the bottom number, which is the heart rate, is
Trust me,
good.
I went to Gatlinburg.
Yeah, trust
What
me.
did you do?
That
What
makes
did you do?
It was awful. It
What
was
did
so
you do?
boring.
Yeah.
It was literally tourist trap in
Okay.
the mountains and
Bye.
that's it.
Alright, so listen.
Yeah.
Listen.
Pretty.
Emma?
That wasn't even all me that time. I spoke
It
two
was
words.
me, it was part of me too. I'm gonna take it.
So, if you had trouble sending me your keynote, Mr. Stevens said, upload it to your Google Drive, and then share it with me that way. So try that, and then we'll see. And I promise, I really am gonna try to get to them and grade them today or tomorrow.
You don't have to grade mine.
I promise.
I'll tell you right now. It's 100.
Okay, here's the other thing. So we're gonna get through these two lessons.
For you.
Listen, we're gonna get through these two lessons, and then on Friday, yes, on Friday, Emma and Lindsay are gonna teach the first lesson, and then the subsequent lessons are just online, they're like activities on your thing anyway. So,
I got you.
these two are gonna work on, actually I'm gonna let them work on how they're gonna teach your third lesson, or the lesson for Friday while we're doing these lessons.
So can her and I go in the hallway? So we can talk?
Miss Wolf, I'm not gonna be here Friday.
Okay. And I
You're gonna miss
think
the best lesson of the day.
Parker, Yaya, and Cookie, you guys leave early on Friday, right?
Oh,
Like at 3 or
I
something?
ain't going. I ain't going.
For what?
Oh, this is, they
LaBelle.
said you guys are leaving at 3, or dismissed at 3. I don't know.
LaBelle's 30 minutes.
What did she say?
Without what?
But football always gets dismissed early for whatever.
Well, you know,
Hey,
because you go,
Ah.
you warm up, you have to do everything there. You can't.
The game starts at 7.
Yeah.
We had a lightning delay and still made it on time.
You don't need 4 hours.
No, you don't need 4 hours.
It takes maybe
If you guys
Oh,
want
you're
to
in
get
team,
on
you.
and
Well, you
go
know,
through
I'm not
the
going.
electronic lessons, you'll
we have
remember
team meal
this
on the
much. I
bus.
promise you, once you get to it, you'll
for a
remember it,
long
Lindsay.
trips like LaBelle.
If you guys want to click through it, just so you can kind of guide them, but
Oh,
you guys
yeah.
are gonna, and here's the other thing I
Do
want
we
you
have
to
to do
do.
the presentation that's on here?
I don't think we can get to the presentation.
So can we just teach from here and
So
pull up
here's
our
what
own
I
stuff?
want, here's what you're gonna have to do. When I'm done here, I'm gonna have to give you my iPad, and I want you to see if you can get the presentation off of my teacher module and put it on there. Does that make sense? If you can you AirPlay from an iPad here?
Yeah.
Can you
Yeah.
AirPlay from my
You can
iPad?
do it right now.
Yeah, you're here right now.
Well, let me do this. Let me get through this, and then I'll let you do it while they're deciding, while y'all decide if you're gonna do your quiz or you're gonna do your worksheet.
Oh, we're gonna
Imagine eating banana on purpose. That's disgusting.
It's up to you. You can. Did y'all finish your pretest?
Oh, yeah.
No.
Okay.
Was that
Are the presentations like the thing they gave me like a K5?
You sent me yours.
Yeah, I didn't do a note though.
It's okay.
Okay.
You didn't have to. They didn't. Some of them didn't. either.
still going on a trip.
But and the people who used Keynote though were having trouble emailing.
Yeah,
They
it was-
were good.
That was a big
I'm
deal.
sorry.
We are still going on
Yeah.
a trip. Yes, it's not.
Okay.
It's not Times Square.
Why the heck are these ones missing?
Why did this turn off?
Okay, and it's just holidays. It just wants to sleep.
I missed that.
How do I undelete it?
People, I wish everyone.
There should be a turn on button on the bottom. You guys
We all wish we could change something about it.
Oh my
I'm
God.
sure there's people that didn't want to go to New York.
My computer's so loading. What is that? Like 95, 96. It won't let me go slow because it has to be. Yeah, this
Why is this?
I
I wonder if it's too big for your Google Drive. Do you have a bunch of other documents in there? Because I know he said that there's only so many gigs in your Google Drive versus, what about your iCloud drive? He said try, if that doesn't work, try your iCloud drive.
I love Times Square.
If you go to,
Like,
if you, do you have, are you signed in, do you have an iCloud account, like an Apple ID and stuff for your school account?
Yeah, we all have Apple ID.
So try to go to iCloud and see if you can see it or put it, or upload it into iCloud Drive.
I mean, yeah, it's.
So you're a Trent, so you're like, oh, Trent.
You like the Broadway show I get for like
Yeah, and then.
Hey, realize Gatlinburg is gonna be a lot more comfortable than New York.
What?
The
Well,
problem
maybe
is-
we'll try, maybe we'll try to take
I
it to
wanted
him.
to go to New York for sure.
So freeze.
No,
What do you have, what's your other?
Yes, that's how that works, Parker.
But it's not like you're walking through a Western movie, it's still urban.
Let me
No,
see.
it's not like
I
Nashville.
will
I've been to Tennessee.
Nashville is
I
west.
would
ask him.
rather go to Nashville than to Gatlinburg.
Let me see if maybe we have time. I'll ask
It
him.
doesn't matter if you can drink,
Oh my
Parker.
I mean, that's what Nashville is.
Okay, what's up, y'all?
So,
I'm just gonna wait for
Last
that.
year, I was
or Thursday, whenever we had left.
Okay.
I had started the presentation,
Alright.
I looked out of it, but you had to go back in and.
I'm gonna go snow tubing. Are you kidding?
I think,
Yeah, tubing in the snow.
I think, and unfortunately I learned this from your predecessors who used to do this all the time. They used to just go in it and just randomly answer stuff so they could get through it. So I think it just gives you one chance to do it. If you don't do it, it just marks them all
Yeah,
wrong.
it's just, and now it's just open to watch.
So I went to
Mr.
Google
Jones
Drive
told me
and
to
just
come
copied
out.
the link.
And if you get it to work, I might have you help Grace here in just a little bit because she's having trouble. Okay, all right, let's go. Let's see if we can get this done. Friday, you will have a sub in here for me.
Who? Shay?
I don't think you've met her yet. Her name's Tammy.
Tammy?
She's got a little
Was she here
girl.
last year?
What does she look like?
She was here one day last year.
That was the one that.
What does she look
That's the
like?
one that
Yeah, that's the one that Keziah made mad. That's the one that Keziah made mad.
Wait,
It
what
was
does she look
funny.
like? What does she look
What's
like?
her-
Real
what's her
straight
last name?
blonde hair. And she like a straight
Her last
face
name
with
is
like.
Racker, but her
no.
daughter's last name is not the
Yeah.
same as hers.
Miss-
Real
Miss
blonde
Miss
hair.
blonde.
And then was like strict and all that.
Miss Spracker?
No.
That's her last name.
I don't know. But whoever that was, Keziah really made mad.
I want Shay.
Miss Wolf, I just said
Not
that.
so bad.
Okay, remind me to check it. Are y'all two gonna go get your lesson together?
Yeah.
What?
Do you want us to go now?
I didn't say nothing, I just came.
Or do you want us to be in here for some of this?
No, actually, you could be in here for some of this because you might want the information, and then Tammy's gonna grade you guys on your teaching, and that's gonna be your quiz instead of.
Tammy, the one they're saying is strict? I'm not grading my teaching.
She's fine.
Tammy's gonna
No,
suck
she's
up
not
that
cool.
me on my grade.
She's not
She's
strict.
nice.
She's
She's just
strict
straight.
whenever you tick her off and you do bad stuff.
So
And
Keziah.
And
That
so
was
basically
really
Parker
annoying
to
her.
not be here on Friday.
yeah,
She
and
knows.
there's-
I don't think I'm gonna be here Friday.
No, I don't talk with strict teachers. I talk with teachers that are nice, because I'm not.
Okay.
as long as you're not disrespectful like Keziah was.
So listen, we're gonna talk about. Remember last time we talked about health information technology, and now we're gonna talk about how it impacts providers. So, actually impacts or supports healthcare providers. So we already talked about how all kinds of different entities use electronic health records or information. And healthcare facilities share their medical findings to providers. We talked about that so that they can have better client care. And then we're going to talk about pharmacies. Even though we talked about that a little bit, we're going to talk about it a little bit more. Okay, so how do you think before the implementation of like electronic health records, how do you think client information and files were shared?
Paper,
Facts.
mail.
Telephone, fax, the actual, you had to go to the hospital to pick it up and sign a release saying,
Imagine.
yes, this is me, I show my ID and I'm getting my health records and I'm taking it to my new doctor, which is kind of a pain, for sure. What happens if you were on vacation in Vegas and you broke your leg and you had to have emergency surgery while you were in Vegas, and then you came back home and you had to see the orthopedic doctor, and the orthopedic doctor's like, ooh, I think they put in a wrong size rod or they messed something up. I need those records from that hospital. Well, it's a pain to get them because obviously you're not going to go fly back to Vegas and go to that hospital and try to get your records, but we used a lot of fax. We used a lot of, and usually that's the biggest way we did it. Or by mail, like way back before fax, obviously they had to mail them. So the thing is, you have to have signed permission though to have those.
I always.
You have to have signed permission to release your records. So when that happens, you know, you have to say, yes, I attest that these people can have my records. So what if what if somebody's here, we have a lot of seasonal people, right? So what if somebody's here for the season and they have chest pain and have to go in the hospital and they say, well, yeah, I had heart surgery last year in Cleveland because that's where I'm from. Well, how do we know exactly what surgery they had? Because they don't remember. They don't remember the doctor's name. So it becomes quite a bit of a hassle. And so having electronic records makes that a whole lot easier. Oops. Sorry. I went backwards. Oh, gosh. I'm sorry, guys. I always think it's the wrong way. Okay. So how does it benefit? Other providers need to see that information, right? So it allows all providers to access the client's health information. It also has better control because you have better control over who's looking at it. If it's a paper chart laying around, you know, some transporter who just happens to walk in the ER and be like, they're standing there waiting for something and they see a name and they're like, oh, that's my neighbor's name. Let me look at that. You know, like they could very easily pick that up and look at it. But with electronic health records, you have a username, you have a password, you have more security as far as who can restrict it and who can't. Like, for example, at Lee Health, even though I work there and I have access to the record system, I can't look up my own lab work. Like, I could get fired if I got on the computer and looked myself up because it's a breach. Because what would happen, here's the scenario. Let's just say I had surgery because I had a growth and the doctor, you know, I had surgery and they took it off and they're like, okay, we're gonna send it, make sure it's not cancer, blah, blah, blah. Well, let's just say I hadn't heard back from my doctor yet and I was at work one day and I was getting nosy and I'm like, let me just take a look at that. And lo and behold, what if it says it's cancer? Then I start freaking out because I don't know enough to really interpret those results other than I'll see some words that I think mean it's cancer. And then when in truth, maybe it is, but it's a very mild type or very easily treated, but here I am freaking out and, you know, they want to be able to have the provider who ordered the test explain the test results to you. And so that's why they don't want people looking up their own test results.
So if you ask your supervisor if you can do that, if they do it for you, no, they can't do that.
And I couldn't do it for you. Like, let's just say you were like, hey, Miss Wolf, I had an x-ray yesterday and they haven't told me my results yet. Can you look it up for me? I'd get fired. I can't even do it for my kids or my husband. So there's a lot of security.
I really don't understand the point of that.
Well, I think it's just because they want to make sure that the doctor who ordered the test is the one who's explaining it to you in case.
Yeah, but if you
You
have
know.
a tumor and the doctor hasn't told you the results and they're in,
That's
Well-
that should be a breach on the doctor.
No, I mean, they do. It's just a matter of, you know, how quickly they give those results to you or how quickly they can get in touch with you or whatever. But think about it. I have access and I have a different level of knowledge than the actual physician, but you know who else has access? The lab tech, the x-ray tech. Everybody has a different level of knowledge, although we all have access to the record. So that could prove dangerous. If you don't have the right amount of knowledge to interpret the results, you could misinterpret something and then
you change your password or like and do all that like every like.
you do have to change your password. So just like anything that I don't know some of the apps that you guys use or your computer, but I know at the hospital every 90 days we have to change our password so that, you know, people can't get into your stuff. So, and it helps people, the client themselves, by being able to get quick access, accurate information, and it helps you improve that care that they give to people. So how does it help healthcare facility staff? So referrals. So when you have an electronic record, you can refer patients back and forth really quickly. And that's something that we use a lot in the ERs because oftentimes, especially with the hospital I work downtown, a lot of people don't have a primary care doctor. They don't have access. They don't have a car. They can't drive to the doctor's office. They don't have, insurance. They don't have a primary care doctor. So what we can do is when they come to the ER for something that they need to follow up with a regular physician for, or they need to go see a heart doctor or a neurologist or whatever, we can actually make those appointments for them and set all that up so that they're getting that continuity of care and they're getting to see who they really need to see. It helps treatment because they can see a 360-degree view of the client's treatment. They can see what they had done before, where they are currently, and that helps them decide their treatment. And then obviously your test results, your x-rays, you can also access the results you need to see, and you don't have to get a delay. Like back in the day, if it was you were waiting days for an x-ray, and I used that example I think the other day. Like you go to one hospital and you're having a cough and shortness of breath and you get a chest x-ray. If you go 2 days later to another hospital, they're going to be able to see that result. They may choose to redo that x-ray because they may want to compare, well, are you better today or worse today? But they will still be able to have that information and use it to evaluate you. So what about pharmacies? How do you think it benefits pharmacies? We talked about this a little bit. Who remembers, what is it they always say about doctors? They have terrible what? Handwriting, right? So when you're writing a prescription for someone, don't you think it's important that the pharmacy be able to read it?
Yeah.
For sure, because you don't want somebody getting the wrong medicine or the wrong dose of the medicine or whatever. So that's one way that it benefits its readability, because they're typing it in now, they're not writing it, so you can read it a lot better. What about efficiency? There's less time on the phone getting, because sometimes doctors used to have to call the pharmacy and say, I want to call in a prescription for a patient. Well, you don't do that anymore. It just comes electronically, and that cuts down on time. And then we talked about this before, drug interactions. It's going to cut down on those medication interactions, because oftentimes most people get all of their drugs filled at the same pharmacy, right? Like you don't go to 5 different pharmacies if you have 5 different prescriptions. You get them all at Walgreens or CVS or whatever. So when a new doctor, let's just say you went to a new doctor and they send a prescription and they'll say, and that's something we use in our chart as well, as soon as somebody comes in, one of the first things we ask them when we're talking about what medicines do you take, we also ask them what pharmacy do you use, and we put it in there so that if new prescriptions are written, they get sent directly to their pharmacy. So that helps the pharmacist, because if a new prescription comes in, they have the current list of medicines that patient takes, and they can say, oh, this doctor just ordered this particular medicine. Ooh, I wonder if they realized they were taking this other one, there could be a reaction there, and then they can kind of offset those types of things and help promote kind of safety. So that's pretty much how it helps providers. So that's pretty easy. And then we have one more little section. We're going to talk about how it helps people like you and me. Like how does it help us? Because it does have a benefit to us. How do you think it helps? How do you think having an electronic health record benefits you personally?
So we don't lose it.
That's good. You can always have access to it no matter where you go. That's a good point. I like it. What else? What else could you think?
Well, like, if you find out like you have stuff or like you have symptoms or something, like you want to be able to look at it and you don't have to like call your doctor every time.
Yeah, you can look it up, because I'm not going to remember. I mean, yeah, I get blood work drawn every year. Am I going to remember what my white count what my white count was in 2016? Probably not. But I know where to find that information, and I can go find it there. Yeah. So a PHR is an electronic record of health that you maintain. So does anybody in here? I mean, I know you all go to the doctor, but like, have you ever seen at the doctor's office? Some doctor's offices have it and some don't. They have a portal, a patient portal now, and you can sign in and you can see all your stuff in there.
Yes.
So, has anybody have you seen one of those? Yes, no, maybe? Okay. So, they have all your allergy information in there. They'll have your family medical history, any lab tests that you've had, any medications that your doctor has prescribed, like what vaccines you've had, like if you've gotten any shots or anything like that. So, how do they create them? So they find a tool that's downloadable. So I want you, do you have the App Store on there? Can you guys access the App Store?
We can't access anything.
Okay. So tonight when you go home, when you're looking through Instagram or Snapchat or whatever, Google, or not Google, but go to the App Store and look for personal health records and see how many you come up with. There's tons of them. There's all kinds of them. You can do one for just your medications. You can do one for all of your information. I want you guys to see. I'm going to ask you. I won't ask you on Friday, but I'm going to ask you next Tuesday, if anybody remembers to do it. So, but a lot of times, just like we talked about, most doctor's offices or healthcare providers will already have one that they use, and they'll put you in the system, and you go to the doctor, and you'll get an email that says, we have created you a personal health portal, and then you'll get in it, and you'll be able to see everything that's done at that doctor's visit. And it's kind of nice because, have you ever been to the doctor, and they talk to you about something? Let's just say you broke your leg, and they talk to you about how long your cast has to be on, what you need to look for, when do you start physical therapy, all those kind of things. And you were so focused on the fact that you knew you were going to miss the sport you were playing and that you didn't listen to any other thing they said. And you walk out of that office and you're like, oh my gosh, I don't know what they told me. Well, all that stuff will be in there. So you could go to that personal health record and there would be a list of all the things that they told you. So that is beneficial for sure. So what's the benefit? Everything's in one place. It's accessible. You can incorporate it within your health provider's record, and you can help your doctors make better treatment decisions. So that's good. So so that's what a healthcare provider can do. What can you do with yours? Do you think you can do anything? So let's just say Lee Health has one called MyChart. Anytime you go to a Lee Health facility, they'll give you this little code if you've never had a MyChart access before, and it will create you an account. And then anytime you go to a Lee Health facility, whether it's the hospital, a pharmacy, a doctor's office, physical therapy, all that information will dump in there, and you can access it anytime. So how do you think that would benefit you?
It lets you know when you got like an appointment.
Yes, it does let you know when you get an appointment, and you can set it to give you a notification. Hey, you've got an appointment next week. You can also pay your bill through it. Found that out. They want you to pay your bill, so you definitely can pay your bill. But it keeps everything accurate. You keep track, and you can print out your medicine list, because there's a section in there for medicines. You can print your medicine list or your vaccines, and you can have a current medical history in there, because some people, as you get older too, and you have a lot of things going on in your life as far as medicine wise and your health, some people may forget some of the things that they've had done or some surgeries that they have. And we just talked about you can keep track of all your medicines. So what are client privacy rights? And we're going to talk a whole bunch about HIPAA. But Emma, I think that was your definition that you had the other day, was HIPAA?
No.
Oh, was it? Oh, okay. Did you have your hand up?
I had it. Yeah, I was gonna ask if I could have bathroom.
Why don't you wait? Give me 2 seconds, because we're about done.
Okay.
Okay?
Yeah.
So, client privacy rights. What do privacy rights include? It includes the fact that clients have access, the right to access their own personal health information. So you always have access to your own health information. You can always access it. It is law, and it is your right that information is accurate. So what would happen if it wasn't accurate? What would you be able to do? You could. Now, you can't say, oh, well, I don't believe that my test result was this, and tell them to change that. But you can change some of your personal information. Like, let's just say somehow you were at the doctor's office and somebody put by accident that you were allergic to a certain medication and you're really not. Those are the kind of things that you can change. The client has the right to know who their information is being shared with. So when you go to the hospital, your parents, probably not you yet unless you're 18, but when you go to the hospital, your parents they have to sign all these forms, and one of them is a right to privacy, and it tells you right on there, this information is shared with these people who work at the hospital. We share it with the insurance company so that they can pay your bill, and anyone who is involved in your care. Yes, ma'am.
So when I get my physical done, they always ask me like, you can share, or they ask me at a certain age, like, you can share this with your parents. And like, obviously I wasn't gonna say no, my mom was like sitting right there. And but like, they ask you if you can do that. Like, what's the purpose of, like, why would you not, like, why?
Believe it or not, there's a lot of people who don't have very good relationships with their family, and they don't want their family to know their personal medical history, or that, and some people are very private about what they're going through. So somebody may be going through cancer treatment, and they may not want their mom to know, or they may not want
at a
them.
certain age, like why do
Yeah, I don't know why they would ask. Well, I can tell you why they will ask you that. Why do you think, ooh, this is a good question. Why do you think, and anyone in this room, even though Parker's the only boy, why do you think they would ask a teenager,
Wasn't it about like this might be
Say
not
it.
what it is. Isn't it about like if you're active in certain things?
sexual health.
Yeah.
Yes, because it is law that as a young person, you can seek treatment for any kind of pregnancy-related issue,
Yeah.
sexually transmitted disease, any kind
Without,
of
like,
they call it reproductive health. You as a teenager can access that any of those services on your own without parental consent.
That's what I was
In
wondering.
some
Is it
states,
just, like,
not all states.
Yeah.
In some states.
Okay.
So that is why they asked you that. And that is something that you can do and you don't have to have parental consent for that. So,
Yeah.
but in most instances, they will ask you, who do you want to share your information with? And
Remember the
That is
story
something.
about the nurse who kept asking me that, and I thought she meant active in sports, so I answered wrong.
very good,
Ah.
very good. And then you have the right to be notified if the privacy practices of certain healthcare facilities. So we just talked about that. And a lot of times, like I know at Lee Health, we have medical students and we have nursing students. And that is one of the things that patients have to sign off on when they come into the hospital is that's one of the things they say, you know, we have medical students here, you know, we're just letting you know. That doesn't mean that they're necessarily going to be taking care of you, but we just have to let you know they could be at some point involved in your care. And patients have to sign off on that and know that those people would have access to their medical record. And then you have the right to file a complaint, or if there's a HIPAA violation, and we'll talk more about that too, but you definitely have the right to file any kind of a complaint against anyone who, or a hospital or a provider who you feel like share your information when they shouldn't have. Okay, so that's it. So we talked about how an electronic health record can help the healthcare providers, and we talked about how it can help the clients. So your choice is this. We can, and then the first lesson was actually what an electronic health record is. We talked about that on Monday. So you guys we can review and you guys can take the quiz, or we can fill
Worksheet.
out the worksheet
Worksheet.
together and take it as a quiz.
Word.
We raise our
So,
hands,
hang on,
raise our
yes.
hands, so
So who wants to review and take the quiz? Oh, Parker. Who wants to do the worksheet?
trust me, the quiz is so much easier.
No, it's 4 worksheets against 1, 2, 3, 4, 5, 6 quizzes. So we'll review real quick, and then you guys can take the
Your
quiz.
review is literally the quiz.
So
That's why it's so-
Adrian, you are going to do your quiz.